So you have just gotten a SIBO test kit because we are trying to rule out SIBO. I'm going to go through what to expect for the SIBO test. I'm going to go through it with you and what not to do and what you should do during the test. So just to review, you have the instructions sheet here. If this is your first SIBO test, it is really important that you read through these instructions very carefully. Please wait 4 weeks from your last dose of antibiotics, colonoscopy, or barium enema to complete this test. Wait at least 2 to 4 weeks from your last dose of antifungals, Pepto-Bismol, or herbal natural antimicrobial products. Refer to your doctor's advice. 7 days before the test, avoid the use of laxatives, stool softeners, and or stool bulking agents such as fiber, as well as antacids containing aluminum or magnesium hydroxide. About 24 hours before the test, there's a certain diet you have to complete. Baked or broiled chicken, fish or turkey, white bread, plain steamed rice, eggs, clear chicken or beef broth with no vegetable pieces, water, plain coffee, or tea is allowed. Please no sugar or artificial sweeteners or cream on the day before the test. The day before the test, you should not take any probiotics. About 12 hours before the test, you should fast and do not eat or drink anything other than water 12 hours prior to the test. Do not take any non-essential medications or supplements until the test is completed unless otherwise advised by your doctor. Do not chew gum, eat candy, or use mouthwash until the test is completed. 1 hour before the test, no smoking, no sleeping or vigorous exercise, and no toothpaste. I recommend that you schedule a time for a 3-hour window for you to complete the test so there is no interruptions. The collection is extremely time sensitive, so you have to be very careful planning the morning around the timed collections, and an uninterrupted 2 to 3 hours is ideal. In your SIBO kit, you will see 8 vacuum sealed plastic tubes, as well as the lactulose solution for the breath test, the mouthpiece with the plastic bag for the breath collection, bubble wrap bags to mail back the collection tubes, the test requisition form, the mailing envelope, and the billable stamp. Before the test, you're going to fast, as I said, and then you're going to mix this solution in some water, and then you're going to get your baseline sample. So this is going to be the baseline sample. That's why it's so important that you brush your teeth right before without toothpaste so that we get a good baseline measurement for the SIBO breath test. If you screw up the baseline, and I'll show you in a minute how you would screw it up, potentially contaminating the sample by placing room air into this tube instead of your actual breath. Before we complete the first step, what we're first going to do is write down the date and time on our label, and then we're also going to write that on the collection schedule for the first sample. So I'm going to write down the date, the time for sample number 1. Then we're going to go into collecting the first baseline breath sample. And then after the breath sample, the baseline has been collected, we are going to drink the lactulose solution. And then we are going to wait at 20 minutes to collect the next breath sample. And then so on until we have reached our 8th breath sample, since we are doing the 3-hour collection. Another important point to make is that after you drink the lactulose solution, that you do not drink any water after that for at least 1 hour. So for the first hour of the test, the only thing that you would have drank was the lactulose solution at the very beginning of the test. You're going to first pick up the breath piece, and you're going to breathe into this very slowly. But first you're going to inhale, hold your breath for 5 seconds, and then exhale very slowly. Then that's where we're going to puncture under here with the tube to get the baseline sample. I'm going to have my bubble wrap bags off to the side so that after, when I'm done completing the first specimen, I can put it right into there. We're going to inhale, hold for 5 seconds, then slowly exhale while placing this in there. And we're not going to inhale at all while we have this inserted. So here we go. Then it's done. It's that quick. So then this goes right into the bubble wrap, and we completed sample number 1. Second sample, what we're going to do is we're going to write down the time, both sheets of paper here. So sample number 2, we would write down the time, and then our name, and then we're going to place that onto the second tube. And now we can breathe into here. So again, just like last time, we're going to breathe in, hold our breath for 5 seconds, then slowly exhale. And then we're going to place this underneath for about 2 seconds while we're exhaling, then remove it. Then we can inhale again after we remove this completely from our mouth. So inhale. And that's done. Place this again in our bubble wrap. Okay, then we would wait again for another 20 minutes for our third sample, and so on until we reach our 8th sample. Now we're gonna go through what you don't wanna do. When you're exhaling, you don't wanna inhale at any point when this is inserted. So this is what you don't wanna do. You see how that created room air into there. Another thing that you don't want to do is remove your lips from this. You want to make sure that the suction around your lips is tightly closed around this so that no room air can get in. Hopefully this video was helpful. If you have any other questions, feel free to reach out to the clinic. If you have other questions, concerns, I know it can be daunting to do the SIBO test, but if you allow some time to really ingest the materials, watch this video, kind of go through it a few times, practice blowing into this before actually collecting, I think that would be key. Have fun collecting for SIBO.